Hi, this is Dr. Subhakar, Clinical and Interventional Pulmonologist, Department of Pulmonary Medicine, KIMS, Kondapur Division. Today, this is a case which shows us into the insights of the indications and complications of Cryoline Biopsy, how we have to be prepared while doing the procedure. This is a 65 years old male who is a known ex-smoker, stopped 5 years back, came with right-sided massive pleural effusion. He was admitted under the physician where ICD tube was placed and effusion was drained out. The fluid showed exudative lymphocyte predominant with borderline ADA. It was around 35 international units. So he was referred to us for further management. On carefully looking at the CT, the lung was completely expanded and there were no pleural nodules seen. But there were ground glass opacities and nodules in the right lower lobe. Rest of the lung parenchyma was normal and no twin bud appearance or nodular opacities and nodules were not seen. Hence, a cryolung biopsy was planned and it was decided to take the cryolung biopsy from right lower lobe medial basal segment. So, we had carefully kept a bronchial blocker in the right lower lobe. After taking the biopsy, you could see the balloon being inflated. So even if it bleeds, we were sure that airway was protected. It went nice for the first two passes, and in the third pass, when the chunk was taken, the balloon just got displaced from the lower lobe and it got placed at the intermediate bronchus. Even when the balloon was inflated, it did not completely block the bronchus. And unluckily, at the same time, we had gush of blood and it bleeded. Here, immediately when I went back in, I could see the bleed from the right lower lobe into the right middle lobe, upper lobe, and spilling into the left main bronchus. So, our first aim is to protect the left side, which is a normal side, where nothing and no procedure was done. So, hence, suction was done rapidly and thoroughly from the left side, leaving the right side. When we were sure that no bleed was further seen on the left side and airways was cleared, then we started clearing the blood from the right side. First upper lobe was cleared, then middle lobe, then we came to the right lower lobe. By this time it was around 15 to 20 minutes, and with this proper tamponade, the bleed from the right lower lobe was also stopped. Here we even used local application of adrenaline 1:10 diluted as well as cold saline and tamponade effect from this inflated balloon. Here, even cryo was used to remove the blood from the right upper lobe, where we can see the clear marking of the bronchial tree. The saturation fell from 100% to 90%. We could stabilize the patient on table itself and we could stop the bleed on table, and we have extubated him on table. The patient went home happily. The biopsy came out to be tuberculosis and there were no malignant cells, or HBE showed no evidence of any malignancy.